Welcome, everybody, to our webinar tonight. This is Dr. Ziv Simon. I'm joined by my partner, Dr. Ari Rosenblatt, and my partner, Dr. Lloyd Herman from Periodontal and Implant Specialists. Hello, Ari. Hello, Lloyd. How are you?
Oh, great.
Ari, please unmute yourself. Hi, Ari.
Hello, everybody. Looking forward to another great sessions with our valued patients.
Thank you. And thank you all for joining us today. We'll start in just a couple of minutes. And the webinars from our practice started during the pandemic, where most people, not just doctors, patients, people in general, didn't know how to handle the pandemic. And this is where we started communicating with our patients through webinars, and that we continued with the tradition of webinars where we share some of our experience as doctors, as periodontists, specializing in surgery with our patients, not just about dentistry or dentistry-related topics, but about health in general. All three of us, we are strong believers that a healthy lifestyle is one of the most important things for us, not just for the longevity, but the quality of life and the enjoyment of life. And hence, we are excited to share some of these practices with you today. The name of our webinar tonight is called The Healing Path, because we want to lay out to you a lot of the practices from our experience. And Ari's been in practice for over 40 years, Lloyd almost 30 years, I'm almost 30 years. So we have a combined almost 100 years of practice dealing with patients and with healing. And we wanted to share a thing or two with you so you can incorporate it in your own life, and also answer some live questions with you. So again, welcome everybody to the Healing Path webinar tonight. Our practice has been in its existence since 1981. Dr. Ari Rosenblatt, our founder, started it. I joined him about 20-something years later. Dr. Herman joined us recently. We're excited to have another doctor with us that brings a new set of skills, more in the healing capacity, in the holistic dentistry, holistic surgeries. And for the some of you who have been treated by him or have met him, you know that his work is excellent, and he fits right into our practice that has a very long tradition of excellence. So both, all three of us have a vast experience in surgery. We are periodontists and implant specialists, which is a surgical specialty in dentistry. So the experience we have is not just the clinical skills, but also how to set up our patients for the best possible healing. You can have the best surgeon in the world, but if your body doesn't heal properly, then that defeats the whole purpose of having a great doctor. The good news is that our body is programmed to heal. It's almost on autopilot, and we need to be able to tap into the body's healing potential, whether it's healing from a simple paper cut or having a full total hip replacement. The body knows how to heal. We should probably not interfere, and that's some of the advice that we're going to give you today, and it will pertain to dental procedures such as extractions or gum grafting or other procedures you've had in our practice, but it also pertains to healing from surgery in general, because the body needs a certain care and certain instructions and certain treatments to heal in the best possible way. Now, the body knows what it's doing. It knows what to do. Every second, I think the last time I checked, there were over a few trillion chemical reactions happening in our body right now. So this second 1 trillion chemical reactions that we don't even think about or know about, and they're happening on autopilot. So the body knows what to do, and what we're going to share with you are some of the best practices when it comes to healing, when it comes to nutrition, what to do before and after surgery, how to stay infection-free. We're going to talk somewhat about light therapy or laser therapy, some of which we're doing here in the office. We're going to relate to some chronic conditions that a lot of our patients have. And then we're going to finish off with talking about the importance of the right mindset for great healing. And then we'll do some questions and answers. And this session is also being recorded, and we'll share this with our patients as well. And also feel free to share this with friends, family, if you find it useful. And we hope you will, because we spent some time gathering some of the best things that we do in our practice, but also in our personal life. And coming soon is a book that we wrote about how to heal. It has the same name as the webinar, The Healing Path. And in this book, which is right now in the editing phase, we are sharing the best practices that we have gathered with our joint almost 100 years of experience in the medical dental field. And we hope you'll find it useful. And we're going to distribute this book free of charge in an online form, but also in a printed form, because we believe that the most important thing after surgery, besides having a great surgeon and having a flawless procedure, is to have the best healing possible. And these are the best practices, some of which we're going to share with you, and all of them will be shared in the book. And when it's ready, we'll share this with our patients. But before we get started, we wanted to talk about recent events. One of the most traumatic things in the past years is the fires and the loss of property, life, and quality of life, and a lot of hardship for a lot of our friends, patients, colleagues that lost a great part of their life. And this is obviously very disturbing to all of us. So we want to express how we feel. And we also wanted to share what are some of the things that you can do in light of what's happening here, because there's something very simple in, every student learns in, first year medical school in physics, the law of mass conservation, pardon me. When a house disappears, goes from a house with everything in it, and it disappears, it doesn't really disappear. The mass stays there and it converts to something else. So Ari, why don't you share with us some of the best practices in light of the fires, and maybe say a few words about our colleagues and our friends and our patients that have been affected by the fires.
So unfortunately, this fire in many different areas of Los Angeles affected all our lives, and I'm sure that everybody knows somebody who has been affected by either loss of house and loss of use of houses. We personally know many patients, including 5 dentists who lost their total belongings. In fact, we know of 2 dentists who actually lost in the Pacific Palisades their professional practice. And besides the personal devastation, we are now dealing with the after effects. Besides such psychological factors and emotional factors, I like to exercise and jog. And today in the morning, I woke up early and the sky is blue and everything seems to be fine again. But unfortunately, we are dealing with the after effects of the toxins, and we would like to educate you and give you some more information in regard of what we are doing now in the office and what you can do at home in order to protect yourself. So Ziv, if you don't mind, advance the slides and basically show us what we are doing now and what we learned from the previous catastrophic effect of the COVID particulates. And now we are dealing with smoke and ash and all the after effects of our houses burned down. And even so, at this particular time, the air looks clean. Unfortunately, if one goes into the details and doesn't just look at the general numbers that are being televised or in newspaper about the certain numbers of air qualities, we are dealing with some particles that unfortunately are not visible to the eyes. And I can only advise for people who are interested, who want to go into these details. There is a professor at in UCLA, and she has published a lot of data. And basically, she is talking about the big particles that have disappeared, but there are many small particles that are smaller than the blood cells, smaller than the width of a hair, that unfortunately are still mixed in the air. And unfortunately, those particles need sophisticated instruments to be diagnosed from. And unfortunately, those particles are still in the air, and they are being stirred up by winds and by weather effects. And we need to be aware of how to deal with it. So basically, in our office, we still have our air filters that we used during the COVID affair. And we hope that most of you who either want to stay healthy or have any underlying diseases like asthma or breathing problems have some kind of air filters at home and are protecting themselves for it. So when we advance, we know that those toxins are coming from different things. And as Ziv mentioned, they just don't disappear after a fire. The asbestos, the lead and heavy metals and paints and batteries are still, unfortunately, in small particles in the air. And there are not very sophisticated instruments available to the public to be aware about them. So when we exercise and when we are in the outdoor, we should be aware that even so the sky is blue, that those non-detectant toxins are still, unfortunately, around. And so when we go ahead and look at the next slide and see like the air quality index that's everybody is available to download it or being published in newspaper, measures, unfortunately, only the colored symptoms of numbers from 50 to 300. And unfortunately, it measures only the big particles. And the small particles are really not publicized. And we need to be aware that they are going to be around for some times. So we still encourage people to protect yourself. And basically, when there are windy affairs, and unfortunately there is going to be still wind, is please educate yourself about more sophisticated methods that are being published and hopefully are going to be available to the general public. But when there is a wind affair, I still recommend for people who are exercising outdoors, for people who have some underlying diseases, is to wear masks, to be aware and still not just assume that there is a blue sky and the numbers of the big particles are supposed to be minute. And wear mask, have your air filters at home working. And again, when you see here in the slides that there are air quality alerts or whatever, be aware that they mostly are informing you about the big particles, and they are unfortunately not really available to the public and being published about those small particles that are still dangerous and around. So as you know, when you come and visit our offices, you know that we have the IQ Air. We are not endorsing particular products, but they have worked very, very well in our office, and you can see them in our reception area. You can see them in our treatment area. And Ziv and myself, and I know a lot of our friends and patients have bought similar machines for the home. And I just have to share with you that I just asked my wife, without even having any alerts to change the filters, that we changed the filters on the IQ Air, and it was visible to the naked eye that those filters appear to be so much more dirtier than when we usually exchange them like every 3 or 4 months or just in the winter and the summer. And definitely you can see that there are more toxins and things in the air that we do not want to breathe. As a general advice, we would say to you, be prepared, because unfortunately, this may not be the only fire, this may not be the only wind affair, and if anybody has some precaution to be taken, I'm giving just a summary from the friends and patients who unfortunately had to be evacuated and people who lost their houses. One is being told to take the pictures and documents or whatever, but literally I have doctors who told me that they left the house thinking everything was taken, what they could take into their car, but a lot of people forgot the medications. And we had to call pharmacies and renew medications, and doctors had to do this, and they had to deal with insurance companies. So unfortunately, have a box prepared and have a list to make sure that you are not forgetting to take your medication, because that is obviously very, very important. For people who have generators because of power outage or whatever, make sure that they are in a safe distance away from the house because of carbon monoxide poisoning. And it's great to have a generator, but it should be in a safe place and it should be in a certain distance. So as I mentioned before, use protective gears, especially if you are around the area where there is still some ash. You're hearing in the news that the debris from the fire need to be removed by professional people. And if you have to come in direct contact with any ash on your car or any other outdoor items, please don't sweep them just up, but wet them gently so you can remove them in totality. And if you have any kind of ash, you would have to dispose it in a very safe way. And the same for any toys and any pets that are spending time outdoors. We need to be aware that the ash is lingering for a long time and being kicked up by wind events. I want to mention also, when I mention filters or whatever, that I forgot totally about the thing is that we are cleaning the filters in our office more frequently now than before, and the same at home. But somebody mentioned to me, and I was very appreciative, we're sitting for many hours in our cars. And I think that it is very prudent to also change the filters in our cars and do it proactively now.
Right. Thank you, Ari. So we wanted to share some relevant events and how to prepare for what's in the air right now. The air is not the most healthy, even if we don't smell it. Those particles are finding their way into our lungs and into our bodies and into our bloodstream, and we want to be protected. So we're going to continue with our webinar on how does the body heal. And when we discussed this process amongst us three, we identified 3 components for how the body heals, to keep it very, very simple. First of all, the body has an innate ability to heal. These are the natural healing abilities that we are gifted from God or ever created us. The body knows how to repair itself. What a great thing, for this machine to work for, who knows, 80, 90 to almost 100 years. And then we say goodbye. But during those 100 years, the body is repairing countless injuries, countless attempts from the outside to damage ourselves. And this is just an incredible thing. So this is, to me, it's the number 1 component, although it's somewhere in the middle. Then we have supportive practices, which is more relevant to patients after procedures, after surgeries, how you take care of a wound, what type of nutrition do you take, what type of hydration, how do you supplement yourself, what type of healing treatments are out there to expedite your healing, and of course, the role of the mindset. The mind is a very powerful component in healing. There's a very strong, scientifically proven mind-body connection. And we now know from, again, countless studies that your thoughts can affect how you heal. It's not woo-woo. This is scientifically proven, and we're going to share some of these practices in this webinar. And we're going to start with nutrition. Let's start with the basic stuff that we eat. And if I wanted to simplify a diet after surgery, I would have you have a diet that is high in protein, in lean protein ideally, low in carbs, high in fiber, and with plenty hydration. If you can remember these four things, you're going to improve the speed of your healing and the quality of your healing. So this is part of the instructions we give our patients after surgeries. And again, this pertains not just to oral dental surgeries, it pertains to surgeries in general. Now, there are very common nutrition mistakes because when we have dental surgery, we want to eat things that are easy. And it's great to have ice cream, and it's not a bad thing. It's cold and it's easy to eat, but it's far from nutritious. So the most common nutrition mistakes are just eating ice cream or just mashed potato or Jell-O. Traditionally, this is what was recommended, but this is full of carbs. And besides other problems with carbs, well, a lot of carbs are going to sweeten your blood, and it's going to slow down your healing. It's going to slow down your immune system because your cells are going to be glycated. Glycated means they're going to be full of glucose molecules, and it just makes them sluggish and not work very well. So it's okay to have any of those things, but in moderation and not as your main nutrition. You want to focus on those four elements I mentioned before, just to keep things simple. Good things to eat, we call it nutrition as medicine, are leafy greens. Anything green is great. It's rich in vitamin K that helps with clotting. It has a lot of antioxidants. Chicken soup or bone broth, we call this the Jewish antibiotics, is very important for you. It's easy to eat. Just make sure it's served not too hot because that can damage a surgical site. Foods that are rich in good fats like avocado, eggs, salmon, fish. And again, we're not dietitian or nutritionists. We are sharing our experience in regard to what diets, what are the components of nutrition after surgery to help you heal better. So get rid of those heavy carb ingredients and focus on the protein, the healthy fats, the hydration, and heavy fiber, because many of the procedures are accompanied with a prescription for antibiotics, and we want your GI system to be functioning well. Okay, so remember the healthy nutrition, the leafy greens, the lean proteins, whole grains, fresh fruit, but not too much of the fresh fruit, because the fruit, we've been indoctrinated since we were, little children, the apple a day, but, not 3 apples a day or 5 apples a day, because then you're just increasing your glycemic index. You can pick fruit that are, low in sugars, like blueberries, things that are, eat them in moderation. Okay, so bone broth, eggs, leafy greens, protein shakes. Shakes are very confusing. Shakes, when you get them at, at different places, they're rich in carbs. They have so much fruit juice that it's going to slow down your healing. So beware of those high glucose shakes, sugary drinks, not too much excessive salt, and all those processed food, including snacks. So what about nutrition before surgery? I mentioned already Good hydration. You want to get your 8 glasses of water, 8 cups a day. Filtered water is obviously better, free from chlorine. Natural electrolytes, coconut water is great. Those sports drinks, especially the diet ones, are just terrible for you. There's nothing like water to be hydrated. So, and also be hydrated the day of the procedure. Many of our patients, as part of their surgical procedure, we are using growth factors. We are drawing blood and we're processing their blood for platelet-rich fibrin, or what we call PRF. Dr. Herman will talk about the role of PRF and how we use it. Now, if you are dehydrated, it'll be hard to find your veins, and that's going to challenge us in terms of drawing blood. And we can have you drink in the office, or we can go, have you walk up and down the stairs, but who wants to do that before a procedure? So make sure that you drink in the morning. If you need to go to the restroom, we schedule ample time for every procedure so we can have those restroom breaks, and it's not a problem. Okay, a lot of patients forget to drink before. Another thing that was scientifically proven, and a lot of people know about this already, it's a very well-known secret, that intermittent fasting for 16, 17 hours a day can improve your health. How does it work? When you're fasting, your body goes into starvation mode. And that starvation is not necessarily bad. What it does, that mini daily fast, allows the body to eliminate unwanted substances such as different toxins. Some people call it a natural detox. It improves your immune response. It accelerates wound healing through creation of new blood vessels. And the best way to do it is 5 days before surgery and 5 days after, and your body will be primed for healing. And I practice some of it. I know Dr. Rosenblatt does some of it, Dr. Herman as well. We can all share our experiences, but a simple method, without being too scientific and too crazy about the methodology, is to skip a meal. Like, for example, I skip breakfast. I don't eat breakfast. I have my dinner and I have lunch, and I only drink water in between. So if you're doing fasting, that's great. It's going to improve your healing. But again, you don't have to do it. You'll still heal okay. We are sharing some of those practices with you. It's also very important, and it pertains to nutrition, is to take all of your regular medications as you would normally do, unless it's instructed differently by your doctor. And Ari will talk about what supplements to take, what not to take. Dr. Herman will talk about some of the chronic conditions that we deal with, patients taking blood thinners, what to do with those. But remember that you need to take those medications normally. And if you have questions, you always want to confer with your surgeon. Now, some people do the intermittent fasting for health reasons or to lose weight. And a lot of patients take Ozempic. I just got an email that Ozempic is not a cheap medication. It's not always covered by insurance, and it could be up to $1,500 a month. It's pretty significant expense. So Ozempic is a type of medication, an injectable medication that affects your appetite. Okay, it's not going to affect your healing, and we're not in any way promoting Ozempic, yes or no, because it's a medication that has benefits in controlling your glucose and controlling diabetes. But it brings up the discussion about how does it work, and it's really interesting to a lot of people that are taking it, not even knowing about some of the side effects. So it really controls the hunger hormones. So we have a hunger hormone called ghrelin, and satiety hormone, that's when you're full, when you don't want to take this extra piece of cake, called leptin. And obviously, when you have that hunger hormone floating through your body, you're going to feel, we call it hangry. Okay, you're going to feel famished. You would want to eat and gorge on food, and it's not the healthiest. So how does Ozempic work? It mimics a hormone called GLP-1. And when you have this hormone in you, when it mimics that hormone, you feel full. You feel satiated, and it basically tells your brain, I don't need to eat. I feel full. It lowers your appetite and it slows down your stomach emptying, and that leads to weight loss. And it also helps your pancreas produce more insulin, and that insulin takes all the carbs, all the sugars from the blood, and puts them inside cells and in storage. So supposedly it's a great medication. Some patients need it to lose weight that is affecting their health. Unfortunately, we're in Hollywood, and a lot of people take it just to become slimmer and not use the usual methods that we've known about, like exercise, like proper nutrition, and using this medication a little bit too much. So we always have to remember that Ozempic has side effects, and there are many side effects you can read about. But one thing that I want to leave you with is, when you lose weight from Ozempic, keep in mind that you lose 50% of it in fat and 50% in muscle. It's going to make your muscles shrink. Okay, yeah, you're going to lose that weight, but 50% will be in muscle mass. Not a great thing. I mean, we're working very hard in the gym and lifting weights to gain muscle mass, which we need as we progress in life. And if you regain all this weight back, which we know happens if you don't have good life habits and nutritional habits and exercise habits, you're going to regain all of that weight back only in fat. So this is a crazy thing. You lost muscle mass, you lost the fat, but when you gain it back, it's just the fat. So you say goodbye to the muscle. Just keep this in mind. Okay, the Ozempic makers are not going to love this statistic. So I wanted to share some natural Ozempic, something called the mulberry leaf extract, which helps lower your insulin spike. Okay, you can look it up. We intentionally don't recommend specific products. We don't want to have the liability of recommending that, but we want you to look into that and consult with your physician. And also areocitrin, which is the component that makes lemon yellow. That too has the ability to act as a natural Ozempic. It's not Ozempic, and it's not working the same way, but it has the ability to lower your appetite, to control those insulin spikes that are not great for you, and they're ruining your pancreas, and they're ruining your sugar metabolism in your body, and it can actually make you develop type 2 diabetes. So look into some of those natural ingredients. So moving on to supplementation, Dr. Rosenblatt will talk about some of the supplements that he's recommending for proper healing.
Basically, we are going back to our previous recommendation and what we shared in regard of being healthy. And very similar when the COVID disaster happened with us is we wanted to make ourselves healthy. We wanted to increase our immunity. And besides all the multiple vitamins that everybody with their doctor advice needs to be addressing, I would very much recommend for everybody just to review the importance of zinc and B. That is very, very important for your immunity, the health of your heart, and all the functions of the brains. And basically, everybody needs to review those supplements with their physician, because there are very, very few side effects with some medication that you are taking. But we want to encourage you to have this discussion with your physician. And we know that vitamin D, especially in combination with K2, one should not take vitamin D just by itself, because the scientific research has shown now that vitamin D is being absorbed in the body and is much more effective when it's being taken together with K2. So vitamin D is very, very important for your healing, is very, very important for your immunity. And if you check with your doctor with any regular blood test when you check your cholesterol, it's very easy to determine your vitamin D level. And unfortunately, most of us are on the low side because we stay away from the sun in order not to get skin cancer. So we encourage you to make sure that you are at the right level of vitamin D, and it's especially important for the healing after surgery. So in the morning, we like to choose the timing of the intake. And in the morning, we prefer to use the vitamin C, B that are best taken in the morning because they are water soluble. In the evening, with a meal, we like the fat soluble vitamins, the D3s. And basically, again, with the discussion with your doctor, I know that my doctor doesn't only review my vitamin intake, but literally ask me, when do you take certain vitamins? When do you take certain medication? And the new trend in medicine is that even with the aspirin and blood pressure or whatever, that it's being shown now that timing of intake of medication is also important. Certainly, before any kind of surgical procedure, we recommend to you to avoid certain medication. We know that garlic supplements and fish oil and turmeric, including ginkgo biloba, which is basically kind of an aspirin drug, and green tea, have the great effect of thinning out your blood, which is great to prevent heart attacks and other ailments, but are not the right things to be taken before a surgical procedure. And anybody who had any kind of procedure with us will get a written notice to avoid those at least a week and preferably 10 days before any surgical procedures. It has been shown now that cholesterol is really a killer for heart attacks, for strokes, for many other things. But many new medical research is really showing that bad cholesterol levels influence the effect of the healing and really make us think when we see sometime on a patient that they tell us that they are taking their medications or whatever, and we see the healing is really slow. Are you diabetic? Are you not diabetic? And suddenly say, oh, we forgot to check our cholesterol level. So new scientific research in the medical literature really encourages for patients to have the correct cholesterol level with the correct percentages of the high density and low density molecules. And it's very, very important before any kind of surgical procedure, be it with us or any other surgical procedure, to make sure that your cholesterol levels are at the right level, and it's very, very beneficial. We're getting to one of my favorite subjects, that it used to be that sleep was discounted. I do remember in the 80s that one professor at our school encouraged us, and this was definitely a model of the 70s, 60s, that he always told us, you win with 4, you lose with 5. And tell me what I mean. That was literally the inscription at the entrance of a business school in Japan, where the motto at that particular time was sleep less and be more productive, and who cares if you are falling asleep at your computer and are not functioning well. We know now from a lot of the literature that sleep is very important, not only to feel good, but very, very important for tissue repair, that it really scientifically improves the immune system and reduces inflammation. And we are sharing some rules with you. And basically, there is the rule of the number 3. And in the sleep hygiene, the same like we tell you to floss your teeth and brush the right way in dental hygiene, there is the sleep hygiene formula to make sure that you sleep better. And one of the rules that we want to share with you is that it's very beneficial to have your last meal 3 hours before bedtime, that it is important to reduce your stress minimum 1 or 2 hours before going to sleep. And ideally, because of the blue light from any of the digital devices that has been shown to interfere with your sleep activity, to try not to look at your computer and look at your phone. So those are simple rules, and I want to just share with you, since I have 2 adult children and now 3 grandchildren, that when they sleep over at my house, that we are using devices that we think are very, very helpful. Some people can sleep when the bus is driving down the street and roaring and noise doesn't bother them. We do know that children sleep better when they are being surrounded by a white noise machine. We don't need machines. We have now phones with apps that give you a relaxation white noise, and you can choose it. But I do know that this is very beneficial. And I do know that this white noise background makes my children, including my grandchildren, fall asleep much easier without any big distractions. There are other tools that I personally want to share with you. I'm particularly very noise sensitive. So in my house, those items are sitting next to my bed when I travel. That's the first thing that I'm checking, that it's in my online baggage. And I cover my eyes in order to make sure that I am surrounded by darkness. If people have the luxury to have blackout blinds, even better. I use the silicone earplugs, which drown out 80 to 90% of the outside noise. And just for anybody who likes this, don't drop them very deep into your ear. It's enough to just mold it into your ear, and that gives you enough noise protection. And for a long time, sometimes with stress and other family affairs or whatever, it's difficult to go to sleep. I tried the sleeping tablets with all their side effects, and for years, I am now taking prevention-wise every night 2.5 milligrams melatonin sublingual, without knowing and now discovering the scientific evidence that's now coming out that melatonin is a very, very powerful antioxidant, a very powerful medication in order to improve your immunity. And basically, since I'm doing this for a long time, researched any kind of side effects, and there are basically none, as long as you don't go into the 10 and 12 and 50 milligrams that the side effect would be that they make you drowsy. But those 3 items just help me immensely. And I don't have to tell you that when you do have a good night's sleep, not only do you feel better, but rest assured that there is scientific evidence now that it's affecting your own health. Speaking of sound machines, we do travel with our children, including now our grandchildren. So now we have a mobile baby shusher, which is a sound machine, and it's smaller than the fist of your hand. And what I found out when I'm traveling with it is that I want to sleep close to it because it puts me also to sleep. So you have even a mobile baby shusher if you don't have anything on your phone as an app. The last thing that we want to share with you regarding sleep. Every one of us likes to measure ourselves. So Ziv, myself, and Lloyd also, we exercise. And when we do exercise, God forbid, we don't measure us. How fast did we run? How quickly did we finish our walk, run, and how much weight did we push or whatever. And I got very early introduced into the Aura ring that now actually different in the picture has like a 4th edition, which is like the newest version. And basically, the Aura ring doesn't make you sleep better, but every one of us likes to get feedback. And I love to get the feedback in regard of, did I go at the right time to sleep? What was my quality of sleep? And when we speak about health benefit of sleep and the related snoring and deprivation of oxygen, this little ring monitor even tells you the exact oxygen loading of your blood and tells you if you have sleep apnea or if you are snoring too much and compromising the quality of your sleep. So the nice thing about it is that not only does it monitor it, but it keeps an historical history of the quality and the measurement of your sleep. So the interesting thing is that now with viruses being around and being a little bit sick or whatever, the Oura Ring literally tells you that you better be careful because something is happening in your body, your temperature is going up, your sleep quality is reduced. And it basically is, for me, a great reminder. It gives you a little notice. It's time to slow down. It's time to start resting because you should go to sleep in an hour. So it gives a lot of feedback. So again, there are many other different kind of similar products, but this is something that works for me. I gave it many years ago as a present to Ziv, and he loves it. So this is something that I think you should consider having as a great feedback and monitoring the quality of your sleep.
Thank you, Ari. Yeah, so we are sharing a lot of things here. And again, we'll share the replay of the webinar. And you don't have to do all of these things, but if you incorporate, 2, 3, 4 things out of this webinar, that's going to improve the quality of your life, not just the quality of your healing, that too. And we want to make sure that what we are implementing in our own personal life, in our practice, is not a secret, and we are sharing it, with full, with generosity and transparency, so it can benefit our patients as well. So next, Dr. Herman will talk about some of the basics of healing and also what are the treatments that can accelerate the healing in after surgery, and some of which we are providing here in the office. Okay, Dr. Lloyd, we can hear you.
Okay. Thank you, Ziv. There are definitely many little adjuncts that we use in our office to help us to get our patients to heal better. So some of the things that we do go along, are we going further on the slides?
Yeah.
Okay. So some of the things that we do use in our office are using your own blood to help you heal faster. We take the stem cells from those,
Let's just go take a step back for a second. Let's just go from the beginning, and maybe I'll do this introduction, Lloyd, if you wanted me to go through the just the basics of healing. And it's very important for our patients to understand. Us specialists, we are not technicians, and we're not, doing a surgery and moving forward. Everything that we discuss with our patients has an intention. So the instructions are very specific to make sure that you heal very well. So maybe, Lloyd, go through, what are the pillars or the important things of each part of the recovery, and then we're going to go more into the specifics.
Yes.
That's okay.
Yeah, no, I got ahead of myself there. So
Yeah, you got excited.
So,
Okay.
in the healing path, we already talked about, preoperatively, what do we do? We make sure our hydration's good, we're eating well, we concentrate on some fasting, we also want to prepare ourselves in advance for when we're going to heal. We want to make sure we get all the foods that we're going to need for that healing. We want to make sure that we're all prepared. We have all our to-do lists done, because if we're actually worrying about that we have to get certain things done during that healing process, we're going to stress our body. Our body wants to heal, and we're actually distracting it with stress. Stress hormones don't allow the body to be at its maximum healing potential. So really, we want to get prepared in advance, have all our foods, have our nutrition, maybe even get some blood tests before the procedures so that we know what our body is doing. We want to know our, our glycemic index. We want to know if, we're our HDL, LDL, all these things are all things that help us to know how we're going to heal. We want to, as Ari was talking about, we want to have all the supplements that are going to help us heal. And so this is all part of the process. And when we're going into the process, we want to make sure that we have support. So post-operatively, we want to make sure that we can take care of the wound, because as Ziv was talking about earlier, he is telling us that our body can heal. So how do we enhance that healing? We're allowing nature to do its work. But in addition, we need to make sure that we follow certain principles that are important for healing, such as if we do a big surgery and we need some antibiotics to help the healing to go along, we need to follow those instructions, because sometimes we forget what exactly it is that was instructed, and then, we skip an antibiotic, time period, and then we get behind, we forget. And so that can enhance, or not allow the healing to go as well. So, do you have any additions to that?
So what I wanted to add, Lloyd, when you're recovering from a surgery, the instructions match the goals of the procedure. So, for example, if you have a surgical wound, one of the key factors in good healing is to prevent infection and trauma to the surgical site. So keep it in mind, if you had a surgery on the lower left-hand side, you want to do all the chewing on the right side. Obviously, this is almost like common sense. And this is why we give you all these instructions afterwards. So prevention of infection and trauma is key in healing. Second, we want to minimize some of the inflammation. Inflammation is a good thing. The body does what the body needs to do, and the body heals through inflammation, and patients heal very well. Most patients do. So if we can control that inflammation with anti-inflammatories or with ice packs, that's favorable. And then, of course, we want to have a great recovery with the least amount of pain. When the body has a surgery or an operation, any part of the body, part of the inflammatory process, one of the signs of inflammation is actually pain. Your body is telling you, stay away from that region by producing a pain sensation. So don't look at pain as a terrible thing. Now, we can give you the right instructions to minimize that pain. So these are really the 3 pillars of recovery.
Yeah, so just to add to that, in respect to, we do want to, in consideration with the whole narcotics problem in this country, and problems with sometimes patients will get addicted to a narcotic just because they had a surgery. So probably the best way to avoid that problem is to stick with the ibuprofen, Tylenol combinations. And studies have shown that by combining the 2 of them, they actually can work as effective as a narcotic without all those side effects. Because when you're taking narcotics, you're feeling a little groggy. You're feeling, you're not really supposed to drive a car. You're not supposed to operate heavy machinery. So really, trying to stick off that type of medicine is the best way to recover well. And even it causes problems with the gut, and so you're just not even feeling good. So when you can stick with something that's not going to have all the side effects, that's much better. So now, what other things that we're looking at here, Dr. Simon? Ziv?
Yeah, so one of the pillars of healing, of proper healing, of great healing, and this is what we wish upon all of our patients after surgeries, is to minimize the risk of infection. We're happy to report that the risk of infection after the procedures we do in our practice is about 1%. Okay, so there's always, any bell curve has two sides to it, but we want to even minimize the 1%, and that's why we prescribe antibiotics, because the mouth is contaminated. Now, the mouth has bacteria that can infect the surgical site. So following instructions and taking antibiotics can prevent that. Now, antibiotics, unfortunately, have side effects. So for most patients, we recommend a probiotic. This is one brand amongst many that you can find out there. It's just very simple to go to Whole Foods. To our knowledge, to our research, most of the products at Whole Foods, at least used to be before Amazon took over, were very heavily scrutinized and underwent serious testing. So most of the products in Whole Foods are legit. They might not be the best in the world, but it's pretty safe to go to Whole Food and pick up a probiotic. Here's one example, and it can be given in a liquid form or a pill form. Now, Lloyd, you want to talk a little bit about the natural probiotics out there?
Yeah. Could I ask you a question? My screen isn't following anything right now, so I'm a little.
Okay.
Well,
What is
I have nothing on my screen.
Okay. Okay, that's a problem. Let me just go off camera and check on your screen for a second. Okay. Okay.
Okay, so now
Ask and you shall receive.
I
Okay.
was I was a little bit lost because my screen wasn't following where we were going, and I know we had practiced and I didn't see anything. So thank you for that update. So when we're doing antibiotics, we want to keep our gut healthy. So what are ways to support our gut? Yogurt is one of the old-fashioned types of things. Sauerkraut, which is a fermented food, kimchi. Depending on what you like, you can mix this into your diet. So what I always tell patients is that when you're taking antibiotics, you need to support your gut. How do you support your gut? So the antibiotic, what it does is it kills both the good and the bad bacteria. What are in your gut? There's both type of bacteria. So when that runs through your system, you're going to kill even the good bacteria. So what that will lead to is diarrhea and upset stomach. So we want to make sure we repopulate the gut with proper bacteria that are going to help support you. And as well, those gut bacteria are what help break down the foods. It helps to bring in nutrition into your body. So really, that's an important thing. And so what I always tell patients is that they take their antibiotics, and about an hour or two later, that's when you want to incorporate your probiotics, because the antibiotic comes through, it clears the system, it kills all the bacteria. You want to repopulate those bacteria after that amount of time. So how can we tap into the maximum healing potential of your body? So our blood has the ability to help us heal. So one of the things that Ziv was talking about is hydrating before the procedure. So if you're not going to be having IV sedation, because the doctor that's taking care of your IV sedation is going to tell you not to drink water for many hours before. So that's a different story. But if you are having an in-office procedure where you're not having IV sedation, definitely make sure you hydrate. So why do I tell you this? Because we're going to draw your blood. That's what platelet-rich fibrin is. It's where we draw the blood and then we spin it in a centrifuge. What happens is the different components of your blood will separate out, and the blood cells which don't help in your healing, they separate from all your healing factors, your stem cells. And here this is showing our setup. This is where our assistants in the sterile area, they make sure that we get the blood cells all separated out, and then we can then mix it with different things that we're using, both the bone grafting material, and also it helps to cover the area. So what are we using from your blood, or why are we using your blood? It helps promote faster healing. It helps reduce the inflammation in the area, and also because of the cells that are in that liquid, it helps in regeneration. So ways that we can control infection, we already talked about antibiotics, but what other leading edge, cutting edge devices do we use? And one of the things that we do use is laser light. We have the Photona laser, and we'll use that to both kill bacteria and also to stimulate your cells to speed up the healing. Also, we do use ozone. We use both ozone gas, which is just like the ozone layer of our environment, the higher up areas that protect us. And so it has the benefit of killing viruses, bacteria, parasites, and we can also use ozone water. We have an ozonator for both the water and just having gas. So this is the unit that we use for our laser. It is called the Photona laser. It's just like if a lot of our clients will go to the dermatologist, get some procedures done, and so this is using light to help heal. So this is us at our training. Our whole team has been trained how to properly use the laser and how to get the maximum benefits for our patients. So the Photona is an amazing laser because it doesn't just have one wavelength. It has two different wavelengths that really help to do different things in healing. One is going to be attracted to our certain parts of the healing process, and the other ones are going to help other parts. So what does a laser do? So it promotes healing. It'll kill bacteria and reduce the risk of infection. And also we can use it to stop bleeding. And so this is actually showing the twin light protocol. So with our light walker, we can actually help, doing periodontal procedures. So what is a periodontal procedure? It's usually having to do with when we get deeper gum pockets in the area around the tooth, or possibly even around an implant. And so bacteria get down in there. So we have to then get in there with the laser, clean off the root surfaces or the implant surface, and disinfect it, clean it out real well. And as we go along in this photo, we can see that there's a blood clot that's formed that will help to form new tissue. So here's an example of procedure where the patient's gum was really inflamed, and it shows that within 2 weeks that area is recovering very well. And so then we can go to another aspect of our healing, red light therapy. So what we do have is specific wavelengths. Red light can stimulate our cells, our mitochondria, basically. The mitochondria are the power packs of our cells. So the red light therapy will stimulate those mitochondria and activate them so that then they start producing energy in our cells. And so we do have device in our office. Our laser has a red light, and also you can buy devices that you can have at home. So PBM, what is that? So photobiomodulation is our cells are sensitive to light. If you think about, okay, why do I want to go out into the sun during the day? What does it help me do? So the exposure to the sun will help you form vitamin D. So our cells can actually take light energy and convert it into electrical energy into our body. And so I already said that that light will stimulate your mitochondria. Your mitochondria, again, are the power packs of our cells. And through that, we're going to accelerate healing. It also helps to increase the blood flow to the area. And if we're healing from a surgery, we want to get that blood flowing there to be able to get that area healthy again. So this is an example of a red light that you can have at home and basically shine on the area that needs to heal, and that will help to stimulate things. So what does the PBM do? We actually will take our laser and shine it after surgery, or when a patient comes in for a post-op visit, we'll shine that laser light on the surgical area. It will again upregulate the cells, make them more energized. It will increase the blood flow there, and so then that will all be quicker healing. The sports teams actually will a lot of times use that on their athletes in order to warm up their muscles and help them perform better. And so ozone is an amazing tool to be able to increase healing and kill all the bacteria, the viruses, the parasites in the area that we're working. So ozone, we're not talking about the ozone where it's up in the atmosphere. It's a ozone is oxygen, but it's supercharged. It's O3. So by having that extra oxygen, it can kill the bacteria, the viruses, the fungi, and also it stimulates the body to have a natural healing process. So this is an example of our machine that we have in our office, and we can then create ozone gas. On our next slide, we have the setup where we actually make ozone water, and so we can irrigate our surgical sites with that ozone water, and that will help to sterilize the area as well as increase blood flow in the area for healing. So we do this for disinfection of extraction sockets to help us increase blood growth, bone growth, and also to enhance healing. So now what we'll talk about is a little bit of the chronic conditions that we're concerned about and how we help that. So one of the things that we can also do is IVs, and IVs can have a full supply of all the nutrients that we need to have in our body. So one of the things that I love, I find that once in a while, if I'm feeling a little bit run down or been traveling or something like that, I'll go ahead and have a Myers cocktail. And we're not talking about a drink at the bar. This is actually a combination of vitamin C, B vitamins, and so it's an energizing combination. So it improves your energy level, it increases your immune function, and really, after I have one of these, I feel amazing. So this is the list of all that you would find in a Myers cocktail: magnesium, calcium, B1, B2, B3, 5, 6, 12, and high level vitamin C. In addition, with the Myers cocktails, you might get glutathione added to that, so that helps to really support your liver and makes your immune system, boost your immune system. Another tool that we can use is hyperbaric oxygen chambers. So by going into this chamber and being in there for about an hour and a half, we will hyperoxygenate our blood. So areas of our body where maybe the blood vessels aren't distributing the oxygen well, this can help to really push it into our body. And since the bacteria that are usually the nastiest are the ones that don't like oxygen, this will help to get that oxygen into those areas, allow your body to do what it does best, heal. So when we're talking about things that are a long-term problem in the body, with the way that the American diet has gone, we're seeing a lot of diabetes in the population. So one of the things that you have to really look for when you're looking at your labels in your food is, high fructose corn syrup. You want to make sure that everything that you're going to, purchase for your everyday life, and even especially during healing, you want to make sure that you look at what the glycemic index of your food is and really keep the sugars down to a minimum. So one of the things in your blood test, you should always look at the A1C. The A1C will allow you to know how your blood is doing over the last 3 months. So what we want to do is also look at our how our diet is inflaming our bodies. So a lot of people will have autoimmune deficiencies, and that will cause inflammation in our body. Like one of the examples is rheumatoid arthritis, which helps to or causes our bones to break down. And whether or not it's fully genetic or it's diet, there's a combination, I think, of contributing factors. So as Ari was talking about earlier, cholesterol is very important to look at. The LDL level is the byproduct of our cholesterol, and that's the inflammatory component. So you want to make sure that your cholesterol is high for the HDLs and low for the LDLs, because that will help in your healing. And also, if you're going to be having a surgery, you want to make sure that your supplements are not going to thin your blood too much before the surgery. If your blood is real thin, you're having a lot of ginger, garlic, ginkgo, green tea, fish oils, it's going to make it really hard for us when we're doing our surgery to be able to see the field well. So about a week before, you want to make sure that those supplements are controlled. So again, how does your body heal? We're just going down the pyramid. And as Dr. Simon was talking about, or Ziv, were you going to be covering this now? The mind body.
No, I'm gonna actually go into more of the mindset, and I just wanted to both of you, Dr. Rosenblatt and Dr. Herman, and thank you for bringing your own view and your own experience in healing to our practice, because as you can tell, we are looking at healing even before the procedure starts, from the pre-operative nutrition and supplementation and instruction. Obviously, a precise and meticulous, safe procedure in our office, and the post-op care in terms of nutrition, life habits, health habits, and the healing treatments that we provide in our practice. I think with the exception of an oxygen chamber, we have all of them available here in the office, because we look at healing holistically. We trust the body, but we also want to give you the best possible healing within your own circumstances. And this is why we're sharing that healing path with you. And all of that and more will be summarized in the Healing Path book. I wanted to finish off by talking about the mind-body connection as it pertains to healing. Our mind and our mindset is extremely powerful. It's probably the strongest thing in the universe, and we can't even touch it. It's not a physical thing. It's the power of the mind can affect your healing. So how is that even possible? So first of all, we know that the power of the mind is scientifically proven in terms of favorable healing and poor healing, both ways. Why is that? Because our brain is known to be a prediction machine. Our brain is constantly trying to predict what's going to happen next and what's going to kill us, because the primitive brain, or the amygdala inside our brain, has developed millions or hundreds of millions of years ago in order to protect us. And that brain is trying to predict what's going to kill us next. So if we hear something negative about our healing, or we even hear some bad news on television, and there's no lack of bad news, our brain is going to interpret it as danger. And it's going to increase our inflammatory indices. It's going to increase stress hormones. It's going to increase inflammation in a negative way. And all of a sudden, that thought, that negative thought, is going to become a reality. And it's actually going to affect your healing. And all of us know about the placebo effect. The placebo effect is a scientifically proven concept. This is the positive mindset, where when you have confidence and when you have calmness, you will have lower inflammation, you'll have faster recovery. That's scientifically proven over and over again for many, many decades already. The opposite is true as well. When you have a negative mindset, and we call it the nocebo, okay, that's expecting the harm. So placebo is expecting something good to happen. Okay, we want to be in that green zone, but the nocebo is expecting harm. So if you have a negative mindset and you have fear and anxiety, that's actually going to increase your pain and sensitivity, and it's going to slow down your healing. That is true as well. So be careful what type of thoughts do you have, because as negative thoughts enter your mind, that's going to be a self-fulfilling prophecy. So if you're expecting a lot of pain, your body's predicting it, your inflammation will go out, and guess what? You will have a lot of pain. Okay, so it's very important to pick the right doctor. You need to pick a doctor with a positive mindset. And, I'm proud that we have such a great team, Dr. Rosenblatt, Dr. Herman, and I do my share as well, to be very nurturing to our patients. So you want to pick a doctor, and that's true in general. It's not just periodontal and implant surgery and the expertise that we have in the surgical field. You want to pick a doctor that gives you clear explanations. When you have clarity about the procedure, you feel calm, you feel supported. So your doctor should give you clear and supportive explanations and instructions about your healing. That positivity is contagious in a good way, and the negativity as well. So pick a positive doctor that is also using encouraging language, not fear-driven. It's a language that focuses on healing and recovery, where I know that all three of us are strong believers in keeping a healthy lifestyle and a healthy mind as well. So you want to pick a doctor that uses that same language, that doesn't put the fear of God in you, the opposite, that encourages you and believes in the potential of the body to heal in the best possible way. And it also helps if your doctor is very nurturing and warm, not just skilled and excellent with his or her surgical skills. It's the doctor's attitude that can make you feel safe and comfortable. And all of that is going to help you heal in the best possible way. Okay, so when you pick a doctor, when you meet a doctor, go by your gut. Is that doctor positive and using nurturing language, or the opposite? Is it a placebo or nocebo? And the placebo is real. Now, there are certain things that you can do as well. You don't need a doctor for that. You can be your own doctor in that sense. You can do certain things that will strengthen your mindset before surgery. Again, all three of us are big believers in self-help and improving ourselves. So using positive affirmations, thinking about your body's ability to heal, trusting your body. Your body is an incredible machine that has developed for you. It was given to you. It's a gift that was given to you by your parents that conceived you, and that body can heal. So always have that trust in the body if you give it the best circumstances. We also recommend to practice visualization, thinking about the surgical side, not in the technical sense, imagining everything looks clean, healthy, calm. You obviously visited our office. Our office has a pretty calm feel, especially our operating room. And we did this by design. We want you to feel that calm and that sterile environment that is not intimidating, because it will affect your healing from a mindset perspective. And then also at home, when you're healing after your procedure, make sure that you have a very good healing environment. Soft lighting, calming music, focus on your sleep, things that you love to do that calm you down, because the more you calm down, the better your healing is going to be. Okay, and a lot of our patients, they have anxiety, and that's normal to have anxiety before surgery or some apprehension. This is, our partner, Dr. Lloyd Herman, in his one of his poses in Machu Picchu, right?
Yes.
Yoga, exercise is the best antidepressant. The self-induced dopamine in our body is going to make you feel great. Go on a diet, not on a diet of food, diet of bad news. Listening to the news is just negativity. I made myself a habit. I never check the news as I wake up, because that's going to set my tone for the day. And there's enough bad news out there all around the world. Also avoid horror stories online, because everybody's got a horror story that they want to share with you. Find people that encourage you, that tell you good stories, that tell you about that great doctor that treated you, that gave you that great result and that great healing path that we are sharing with you today. And also, there are different ways to meditate. Meditation calms your mind. Doesn't mean you need to go to an ashram in India for 3 months. You can do it in your car. Okay, just don't fall asleep. Make sure to do things that give you that calm mindset that reduces your stress, because that stress reduction will reduce the stress hormones, that cortisol that floats through the body, that adrenaline that we all are almost addicted to during the day. We want to bring it down because it's going to help you heal. And the last message of this webinar is trust your body. Always remember that your body is a wonderful machine. It's here to serve you for 80, 90, even 100 years in good health. This is what we wish for you. There are certain treatments, instructions, supplements, nutritional hacks that can help you heal, plus different types of treatments, as well as the practice of a good mindset. And all of that is going to help you heal greatly. So on that note, I wanted to thank Dr. Rosenblatt, Dr. Herman, for sharing the vision with me, where we don't just focus on precision surgery and technology. And for the ones of you that have visited our office, we do use the top-of-the-line technologies out there. And there's something great that is scientifically proven, we're going to get it. And you saw a glimpse of it in this training. But we also want you to be set up for the best possible healing, and that was the purpose of this webinar. So Ari and Lloyd, thank you very much. We're going to take some questions, if there are any questions from our participants, and then we're going to go home and meditate. Okay, so we're open for questions. So you can post your questions either in the chat or in the Q&A section. Both of them are available for questions. We see a lot of our friends and patients that participated here. Ari, do you have any final remarks about the healing path?
I would only mention, something that you, me, and Lloyd are commenting when we go to a whole day lecture. As you said, we threw a lot of information to our patients, and sometimes it's very difficult to digest everything at once. But I would just recommend to be aware that when we go to lectures and listen to reviews of what is happening out there new or whatever, if we say, like, we may have listened for 10 hours to lectures, but if we can walk away with 2, 3, 4 little pearls that are new and are informative, we feel like that all this work and time was worthwhile. So I would only recommend to our patients, don't be overwhelmed, choose and pick, be aware of the information we gave you about the possible small particles in the air, even so you see blue skies only. Be aware that it's beneficial with your doctor to encourage to speak with him and review vitamins and supplements, because we showed you that they are scientifically proven to be effective for your health, for prevention, for better healing. And basically be aware that sleep is important, and choose your own tools. We shared our tools with you, but pick and choose. If you do only a few things every week, a little bit more, you'll be ahead of in your health and your prevention, and live a happy and long life.
Thank you, Ari. Dr. Herman, do you have any final remarks about the healing path and about maybe the upcoming book? Any thoughts about how do you envision that book helping patients?
Well, I'm definitely excited that we've really helped to come together and write this book, and I think that the book will help a lot of people in any type of surgery, in overall health. I think that we've covered a lot of stuff here. We've covered from supplementation to diet to little tools that we use in our office that can help in healing. So I'm excited that this information is getting out into the public. I think that our goal is always to have our patients heal the best, to be healthy, to live a long, good, healthy life. So I'm excited for this information to be spread to all people that we know.
Excellent. Very good. Well, on that note, thank you so much for attending our Healing Path webinar. If you're watching this in a recording, feel free to share it with family or friends or anybody that is interested in optimal healing. You know, doctors are busy professionals. Like us, we're very busy, but you know, this is after a long day, and we thought this would be extremely helpful for anybody who wants to take this information and improve their own healing and their own health. So Ari, Lloyd, thank you so much on behalf of all of us, and have a great evening. And we'll see you in the next webinar.
Bye-bye.
Thank you, everybody. Bye-bye.